Hi guys. Hello everyone. Thank you so much for joining. Hi. Hello Suhail. Hi guys. Thank you for joining. We shall soon have our expert Dr. Sravya. Hi Eric. Hi. So as you guys are aware, our session today is with Dr. Sravya and she'll be talking about hair fall issues that we all face. I'll just invite her for the session. Hi Mithilesh. Hello Varun. We shall soon have Dr. Sravya along with us. I'm sure you all have a lot of questions related to hair fall and hair health. So please keep your questions ready. We shall have her and she'll respond to all your questions soon. I think there's some kind of a technical issue. We are trying to connect with her. So as you all are aware, we had this session with her last time also in the month of October. And she had spoken about hair health that time also. And today she'll be focusing on hair fall issues. And she's a highly qualified chief consultant dermatologist and cosmetologist at Manipal Hospitals, Bangalore. Stay tuned, guys. She'll be joining in. Keep your questions ready, people. I'm sure you have a lot of things to ask her. Till the time she's joining, you all can put in your questions over here in the comment section and I'll pick up those questions once she's there.
Hi, Rakhi.
Hi, Dr. Sravya. Welcome to the
Hi.
live session.
Thank you
Hope
so
you're
much
doing
for
good.
having me.
Yeah, so we shall begin this live session today. And I would like to thank Dr. Sravya for joining us for the session. She is a highly qualified chief consultant dermatologist and a cosmetologist at Manipal Hospitals, Bangalore. And she'll be taking us through the overall hair fall and hair health issues as well today. Over to you, Dr. Sravya. Could you please, help us understand what are the hair health issues that people are facing these days, and what are the kind of patients you come across, and how best you all you guide people to deal with this?
Yes. So I think as everybody knows, hair is an important factor for, I won't even say beauty, for self-confidence of each person. That is
Yeah.
why there is so much innovation and research going on in today's world, where people are trying to find better and more effective molecules to sort of fight the hair loss. Everybody wants a nice full, head of hair. So, male pattern balding, male androgenetic alopecia, and female pattern balding, though they are two different entities, everybody, what they observe is the top of their head is becoming thinner and more of the scalp is visible. When you tie up your hair like this, they complain and they say, you know what, doc, it's showing on the sides. So it really breaks their self-confidence a lot, and a lot of more younger men in their 20s and 30s are coming these days with a lot of balding.
So, could you please help us understand the basics of hair, hair loss and why it occurs? What are the reasons that people suffer from hair loss?
So to start with, Rakhi, male and female, two completely different
Yes.
entities, two completely different reasons. What is common for
Yeah.
both reasons is genetics, which plays a bigger
Yeah.
role in gender male. Male 95-99% of the time, it is your genetics. That's why it's called androgenetic alopecia. Andro means hormones, which they're referring to the testosterone cycle, which we'll talk about more. So 5-dihydrotestosterone and 5-alpha reductase are the key things that we're trying to address with whichever medication we give for males. For females, it is more less genetic related but more nutrition related, hormone related, because females go through a menstrual cycle, their pregnancies, there's ovarian hormones, all sorts of things going on. There's post pregnancy, post delivery, hair loss, all of that, plus a lot of iron deficiency. So many people.
Yeah.
The minute you give iron, they start getting better. The minute you give biotin, they start getting better. So the different reasons. So we have to sit down with them, evaluate, take a proper history, then we give the treatment.
Understand. So, while we understand that male pattern hair loss and female pattern hair loss are like two different things, and people would be losing hair for like completely different reasons. But do you think scalp health also matters a lot? Like how well your scalp is nourished and how well you're maintaining it, does it also impact the hair loss?
Of course, scalp health, even though it plays a minor role compared to the genetics of it, it plays a huge role. If your scalp is infested with like a fungal infection, even if it's just dandruff, or if it's a fungal infection like tinea, like the ringworm, then obviously your hair is not going to grow properly because your scalp also needs to be clean and hygienic. It cannot have like an infection going on there. So scalp health is just as important. I insist on that also. So suppose, for example, as a patient who's balding with a lot of dandruff, I'll say, listen, first let's treat the dandruff. Let's take care of that. Only then I can give you the hair growth serums and the treatment, because even for the serums to work, the scalp health needs to penetrate inside. So if it's covered with like a layer of fungus, it's not going to go in. So you have to address both issues at once.
Absolutely. So when you're addressing these issues with your patients, do you treat both men and women differently? So for example, the ingredients that you want them to use, are those similar kind of ingredients or actives that you're suggesting, or those are like completely two different things for both the genders? Because common man has a notion that hair loss to hair loss hair, women are losing hair, men are losing hair. They do not understand these aspects, that there are two different patterns of hair losses. So how do you treat such patients, like specifically women and men both? And if you all could, if you could also share little inputs in Hindi, because we have some of our audience who are requesting for some Hindi inputs too.
Okay,
I
Hindi
mean,
is
if you
not
are
my mother tongue, but I'll try. तो लड़कों का और लड़कियों का बहुत अलग से होता है, रीजनिंग ही अलग है, रीजन ही अलग है. तो ट्रीटमेंट बहुत मतलब कॉमन रहता है बहुत सारा, लेकिन there are certain molecules which are different, but overall the molecules that I use are the same. Overall, like
Okay.
I can use minoxidil and redensyl for both males and females, right?
Yeah.
But redensyl and minoxidil target 5-alpha reductase and dihydrotestosterone, which is more in males. इन फीमेल्स अलग अलग टाइप के हेयर लॉसेस होते हैं. अगर आयरन डेफिशिएंसी का हेयर लॉस है तो मुझे रिडेंसिल देके क्या फायदा, तो करेक्टर आयरन. ठीक है ना. पोस्टपार्टम हेयर लॉस होता है प्रेग्नेंट वुमेन में डिलीवरी के बाद, उसके लिए प्रोकैपल ये सब काम करते हैं. तो आई डोंट जंप टू द मिनॉक्सिडिल और द रिडेंसिल. तो अलग अलग लोगों में अलग अलग चीज काम करते हैं. यू हैव टू टेलर इट टू द हिस्ट्री ऑल्सो. बट देयर इज अ फीमेल पैटर्न मेल, like there's a female pattern hair loss which occurs in the male pattern. लड़कियों को भी कभी कभी इधर से होता है मेल पैटर्न में. इफ दैट is testosterone related in a PCOS patient, then minoxidil and redensyl will work even for a female. So it has to be tailor-made, and I have to investigate quite a bit.
Understand. So there's a lot of blood work and a lot of stuff involved when you analyze a patient. Okay,
Yes.
okay. Yeah, because I think women will have like, overall hair loss, and men will begin to have forehead or like, the center of the head. Usually they face problems in these parts of the body, on the scalp, sorry.
Correct.
So, yeah. So, what are the ingredients? Like, so you were just telling me about minoxidil and redensyl. So, like, could you focus a little bit more on these ingredients? Because minoxidil is something that maybe a lot of people know about, and there are a lot of misconceptions also around that. So, we wanted to understand, like, what is really good for hair growth and hair fall issues. Something
So
which does not become.
Sorry.
Yeah,
Go ahead.
something which is not even addictive, but is helping you in a longer run. Because, like, for example, I have heard that using minoxidil and stopping it after a while, you go back to rebound hair loss. And so, if you could throw a little light on all those aspects, because we often get our customers asking these questions: will I have rebound hair loss? What do I do if I stop using a certain product? So, if you could throw a little light on that.
Correct. So the newest molecule that I'm only using, Raki, even before I go to the minoxidil, is the Redensyl, obviously, and I'll elaborate why. So Redensyl, Procapil, Anagain, and Papilla longa is the combination that I'm using for everybody. There's, a little bit of ifs and buts about which combination for who. But overall, let's talk about why I like Redensyl now. Redensyl is a superior molecule to minoxidil. Minoxidil has been the gold standard, is still the gold standard. Now, Redensyl doesn't have the rebound hair fall that most of the patients complain about. Everybody asks me that question. Everybody's like, Doc, abhi main, रोक देती हूँ तो फिर से गिर जाएगा पूरा बाल. तो इसके लिए the rebound hair fall is much lesser with the Redensyl. So the addiction or the long term, you have to use it forever kind of a sentence I don't have to use with the patients. Right? And the patient also wants something that, increases, and then even if they stop, the hair stays on the scalp without falling out. So that is one thing. So Redensyl works beautifully for that, and it's a mixture of 4 new molecules, including glycine, right? So it's a new research molecule. It's shown very, very great results. It's worked for my patients. I've given it in combination. So we always combine it with Papilla longa and Anagain and Procapil. For everybody who's watching, we have very natural pea extracts, which is the Anagain and the not Papilla longa, the Procapil as well. And Papilla longa is extracted from turmeric, which all of you use in your kitchen every day. So curcumin is the biological or the scientific term for turmeric, curcumin. But let's call it turmeric in common words. So it is an extract from that. So everything that is targeted at hair loss includes 3 things. Let's break it down very, very simply for everybody. Number 1, your genetics and your stem cell regeneration, right? The stem cells are present in your hair, around your hair bulb. There's a whole environment around it. That has to get stimulated. That has to be enhanced. That has to be told to grow more and not fall out all the time. In very simple words, not medical terms. The second thing is your hormones, especially in males. 5-alpha reductase, so procapil also, and some things act as plant extracts which inhibit 5-alpha reductase, which is an enzyme that ultimately makes your hair stay there, the anagen phase, the growing phase. So it's not falling up.
Yes.
So you need a 5-alpha reductase inhibitor as well, which is why I find the combination always working, because you're targeting hormones also, you're stimulating your stem cells to grow also, and then the other thing is actually staying in your hair and providing the nutrition and enhancing the growth rate. So you have more counts of hair. So there's two things, right, to hair loss. There's normal hair thinning also that happens in your individual hairstyle. There's also miniaturization. It's called hair miniaturization. That also is a part of hair thinning. Most people say, okay, मेरा बाल वॉल्यूम कम हो रहा है, लेकिन इसलिए इतना ज्यादा कम दिख रहा है क्योंकि इंडिविजुअल बाल का डायमीटर भी कम हो रहा है, तो उसको भी बढ़ाना है और हेयर काउंट को भी बढ़ाना है. दोनों करना है तो तब वॉल्यूम दिखेगा.
Understand. So usually when you refer Redensyl or capilla longa or procapil, so sorry, there's some kind of a disturbance. So when you refer to these ingredients to your patients, what is the amount of time you suggest them to use the product? Because hair issues are not magic. You cannot immediately see the difference on your hair. It does take a little time. So how long do you suggest a person should use it?
So counseling is very important, Raki, and I never lie to the patients. I'm very open about it. I'm like, you have to use it at least for 6 to 8 months, for sure, to at least see or start seeing a change. So first, I always break down the 8 months into 2 parts, right? The first 3 to 4 months, your hair loss will decrease. So the amount of hair you see on your bed, in the bathroom, brush mein aa raha hai, itna sara baal pura bahar aa raha hai, that will decrease. The first hair fall has to decrease. Let's try to keep what is there on your scalp. फिर बढ़ाएंगे hair count and hair volume and hair density. So I give it about 8 months and I always tell them, listen, you have to use it long term. Okay, as long as you want hair on your head, you have to use it because I can't change your genetics. Maybe there'll be some new research molecule which comes out and in the next 5-10 years which solves the genetic problem. We don't know, but we don't have it as of yet. So always the patient has to be counseled for using it at least for 8 months to a year for sure.
Absolutely. Most of our users would often come and ask, I've been using it for 2 months, 3 months, but I don't see visible difference. So we really want to tell our users also, as Dr. Sravya very rightly said, pardon me, there's some disturbance in our office.
No problem. So I'll make it easy, Raki. You know what I tell the patients? You brush your teeth every day, no? You won't brush your teeth one day and say, हाँ, 1 week ठीक रहेगा ना? तो ऐसा ही है. अगर बाल चाहिए scalp पे, तो make it a part of your daily routine. Like you brush your teeth once in the morning, once in the night. Hopefully everybody brushes twice a day. ऐसा ही रात में भी सीरम लगा के सोना है. It should be part of your daily routine. You should not stress too much about it.
Absolutely. I've muted myself to avoid the disturbance. So as you very rightly said that these ingredients or these things, they do take time. In fact, any kind of medical procedure or medical ingredient is going to take time. So have patience. I think patience is the key for us to have more hair on our heads.
Also counseling, and to give the patient the correct information, and you tell them, listen, you have to use it for a minimum of 4 to 8 months, and their expectations in their head also will be set right.
Absolutely. I mean, that's really important, and hearing you saying this definitely is going to reinstate the confidence in all our users as well. One thing I wanted to know, hair transplant is also one thing which people go for. Because men usually will have a lot of hair loss and they'll ultimately lead to bald head. They want to go for a transplant. So what are your thoughts on this transplant? How soon a person should go for this? Is it really effective? Do the hair stay on the head even after the transplant, or they need some kind of serums, for example, to ensure that the hair are not lost after the transplant?
So definitely, to answer the first part, of course, transplants work. It should be your last resort, right? So try everything. I tell my patients, see, when will somebody be okay with the risks of surgery after they've tried everything non-surgical? All of these serums, PRPs, GSPs, they work beautifully. Depends on who's the right candidate. If somebody who's like 80% bald comes to me and say, pura, bare head pe grow karo, then I'll say, listen, the serums are not going to grow anything for you right now. You're a transplant candidate directly. Right? पीछे भी होना चाहिए ना. You have to plant
हाँ,
it from the back, we extract it and we put it in the front. So even the donor
yes,
area जो पीछे से लेते हैं ना, उधर भी काफी होना चाहिए. So it's all about who is an ideal candidate for what. You are
yeah,
not a surgical candidate right now. I will try non-surgically, and then if it doesn't work, you go surgery. That's one option. You are directly a surgical candidate. कुछ भी नहीं है ग्रो करने के लिए. अभी ट्रांसप्लांट ही आपका ऑप्शन है, तो मैं बता देती हूँ. अगर सर्जिकल नहीं चाहिए, थोड़ा थिन हो रहा है, स्टिल ग्रेड 3 ग्रेड 4 ग्रो कर सकते हैं अच्छे से पीआरपी और सीरम्स के साथ. इट्स ऑलवेज अ कॉम्बिनेशन. तो मैं बता देती हूँ. टू आंसर द सेकंड
yeah,
पार्ट द क्वेश्चन, वेदर यू डू सर्जरी, डोंट डू सर्जरी और यू डू जीएफसी एंड पीआरपी, सीरम इज कंपल्सरी. क्योंकि हम बाल तो लगा देंगे या ग्रो करेंगे, उसको रखना है ना, तो रखने के लिए तो सीरम चाहिए. You need something to hold it together because your genetics are something I cannot change. And that is still
yes,
telling your hair, it's signaling it to fall out. That's the genetic
yes.
thing which we cannot stop yet. We haven't discovered that yet. So as long as you want to keep your hair, through whichever procedure we've grown it, you still need to do your serums at night. This also I'm very clear about, right at the beginning. This is exactly how I explain it. We will grow it with some method. Okay, even Redensyl
Yeah,
will grow on your hair. It's fine. But you need to keep it also, you have to keep applying the serum to provide that constant nutrition and stem cell regeneration and stimulation going on for sure.
absolutely. So similar ingredients that you just talked about, like Redensyl and all these ingredients could be prescribed to a hair transplant patient as well. Somebody who's undergone that, we can prescribe Redensyl to them.
Even
Okay.
before the
And I think,
dental, we were giving minoxidil all the time. Even to the
okay.
post-transplant patients, even in the consent form, वो साइन करते हैं. हाँ, ट्रांसप्लांट के बाद मैं पीआरपी के लिए आऊंगी, मिनॉक्सिडिल भी लगाऊंगा, पूरा खाऊंगा. You know the supplements and the serums that's there in the consent form itself.
Understand, understand. Okay, great. That's great to know about the whole procedure. Also, Dr. Sravya, I just wanted to ask lifestyle factors. Like we had discussed last time, lifestyle also impacts our hair. So one of our users over here had asked, does bleaching hair causes hair thinning?
Bleaching?
Yeah, like,
Not directly, indirectly, yeah. So depends on where you bleach. See my colored hair. I always ask them to leave the 2 inches so it doesn't touch the root and then color the rest of the hair. This is fine. However, I don't
yeah,
use a bleach. I go as light as possible. A bleach contains
huh.
peroxide. Peroxides damage the shaft of the hair for sure because it's bleaching out the
Yes.
melanin. As long as it doesn't touch the root and you leave a good, distance, you should be fine. It doesn't cause hair loss. It causes hair texture damage for sure. But it doesn't cause hair
Yes.
loss directly. If you go on doing it and you're doing global coloring or something with bleach, probably.
I think, yeah, definitely. I mean, constantly if we are trying to play with the natural texture of our hair, it's going to get impacted for sure. So yeah, so anything else that you would want to share, like, tips with our users over here, what best they can do to have healthy hair, good, like, routine that they can follow to ensure, like, they don't reach up to the stage of a hair transplant.
I saw somebody ask in the list about dandruff and everything. So we
Yes,
spoke
yes.
about this earlier, but
Yeah.
is finasteride good? Yes, it is good. So to answer, your scalp health needs to be point on, right? You have to keep your scalp clean and dry just the way you take a shower every day. The scalp has to be clean. It's no different. Number two, I want to tell everybody there's a myth that if you wash your hair more, the hair will fall more. It's very stupid. It doesn't. This is dead tissue. You take a shower every day. Scalp is also skin. Scalp also has to stay clean, right? So please, even if you take a shower every day, nothing will happen. In fact, your scalp will stay cleaner. All the gym going people, athletic people, their scalp also sweats. Now the dandruff comes when they don't take a shower and they keep all that sebum, oil, dust, everything there, and then they say their scalp is greasy. Yeah, you have to clean it out. You can't do that.
Yeah.
Number two, wearing a helmet definitely doesn't cause hair fall. Your life is more important. Please wear a helmet. Helmets don't cause hair fall or balding or anything. It is mostly genetic. Can you use Johnson shampoo for cleaning? Yeah, you can, but it's mostly for babies. You can use better shampoos. So all of these myths, please wash your hair every day if you want to. It depends on how oily your scalp is. When you are losing hair, Please don't wait till you go bald and then come to us. Please come in the beginning itself when you feel it's thinning so that our results are better for you. I can just give you a serum and then say, your hair is going to grow instead of doing all the pokey surgical procedures. So always come
Absolutely.
before you lose your hair, not after you lose your entire hair. That is my
Yes.
one tip.
Yes, I think how early we begin the procedure or our treatment is really important. Like as soon as we see, like, a lot of thinning happening, I think that's the right time to just step into a doctor's clinic and get this sorted out, I believe.
It's very crucial because Rafi, these days there's post-COVID hair fall, post-dengue hair fall, post-delivery hair fall. There's a lot of different kinds of hair fall apart from there's the genetic male hair fall, right?
Yeah.
So there's a lot of different types of hair fall that you can deal with, and not everybody has to use the serum forever if it's one of these temporary ones where there's a shock to the
Yes.
body. Is the more
Yes.
genetic patterns ones where you have to use long term. Sometimes the recovery is beautiful in just 6 months. The patient is fine, and then they stop. It's fine. You don't have to use it forever.
Yeah.
Like postpartum, post-COVID, I give it only for 2 to 6 months, and then they're fine.
Yeah. Yeah.
Yeah, minoxidil are various varieties. Yeah, everybody, minoxidil, Redensyl, everything can be used, but Redensyl is better than minoxidil, is the newer one with lesser side effects.
Yeah, and I think no rebound hair fall as well. So that's an important factor. And spending in so much of amount, time, money, everything. And if we go for a rebound hair fall, I'm sure it's a dampener. So great. That was really great session, Dr. Sravya. We really got to know a lot of great insights from you. And I'm sure a lot of myths that people have associated with a hair treatment got rectified over here today. And we would love to host another session with another nice topic that our audience would want to talk about. So see you guys. Thank you so much for joining. Thank you so much, Dr. Sravya. It was pleasure talking to you.
Thank you so much for having me. We'll talk to all of you guys soon. And if you have any questions, you can click in the comments below or type it below, and I'll try to answer as many as possible. The short questions.
Absolutely. Absolutely. Guys, we are available on DM. Whatever kind of queries do you have, please reach out to us. We would love to help you all with best possible answers from our experts. Thank you so much for joining. Good night.
Thank you, Rathi. Bye.
Bye.